Welcome back, everyone, for our final session, a chance to reflect on the discussion and the exchange of ideas that we had in the last few days. The journey of 1,000 miles begins with one step, the great Chinese philosopher Lao Tse once said. And the 1,000-mile journey of our time, that's the 2030 Sustainable Development Goals, of course. They are a mere 9 years away, and that's maybe the most important data point we face. Even though you'll all agree we took way more than one step, it's clear that we're nowhere near achieving the development goals. In fact, we often have to struggle even to get on track. Data and statistics are absolutely key here, both by measuring progress and also what comes to implementing the goals themselves. Looking back on the road that led to Bern, it was not an easy one. The pandemic threw our whole thinking around data ecosystems into question. That was something that many conversations also here at the forum have underlined. So what have we learned about these issues like capacity development or trust in data and accountability? That's what we'll discuss in the coming minutes. I'm pleased to welcome here 4 people at the forefront of the data revolution. Samuel Kabine Anim, please. He's the chief statistician at the Ghana Statistical Service. Then Chris Jones, director of Delivery and Analysis Directorate at the Foreign Commonwealth and Development Office in the UK. Samira Asma, she is Assistant Director General for Data Analytics and Delivery for Impact at the World Health Organization. And Clint Brown, Director of Product Engineering at the Geospatial and Information Mapping pioneer, ESRI. And for questions and comments, of course, I encourage you to use our virtual platform if you're joining us virtually. And the chat function that by now you're probably familiar with, you'll find it right on the session page there. And if you type in your country and the sector you represent, we know who to direct that question to. Now, I'd first like to start with what is maybe the question that is on everyone's mind these days, how the pandemic affected all of your lives and all of your work. And first of all, I start with you, Samira, as the WHO is at the epicenter of this crisis. Would you say that the response by the WHO to the COVID-19 pandemic, was it data-driven enough?
First, thank you, Arthur, for inviting and to all the panelists here. WHO has been the epicenter, as you truly rightly pointed out. But I think the world falls short in the way we have responded to the pandemic. We were unprepared. When we look at it from the data lens, we count deaths, and we can't count deaths accurately. Death is a fact of life, and we will soon reach officially a 5 million death mark due to COVID pandemic. But the tragic human toll due to the pandemic is still a guesstimate, and we are relying on guesstimates. This is a fundamental foundation that every country should have a robust civil registration and vital statistics systems in place, counting births, deaths, and everything in between, but most importantly also the causes of death so that the resources can be channeled appropriately. And not having that, for example, 4 out of 10 deaths globally are unregistered. When we look at Africa as a continent, 9 out of 10 deaths go unregistered. Only 30 countries can accurately report on causes of death. What about other countries? So I think we have, from a scale of data, just deaths, if we take as a tracer, we have not responded adequately to the pandemic. And this is a very serious message. We better be prepared. Let's get back to the basics and get the basic foundation of data and statistics fixed. And we can't wait longer.
The member states, you mean, who should count basic things like deaths, but also, I mean, the WHO, it has received a lot of praise, but also criticism in the response to COVID-19. Amongst those was that there was too much consideration paid to member states, namely China. So do you think that was data-driven enough? In the beginning, especially?
We aspire to be data-driven, and we trust the member states reporting to WHO the data, and often it is not member states positioning, but also we have to recognize that the systems are often not in place. The systems to transfer data in a secure manner between country and the organization is often not adequately established. And now, thanks to the digital innovations, we have begun putting in place something similar to the World Meteorological Organization, where we can look at weather and decide whether to take an umbrella in the morning or not.
Yeah.
Similarly, I think we should be able to track the health trends globally.
Like a data stream to track that.
A data forecast center. So World Health Data Hub and the Berlin Hub for Pandemic Preparedness will soon be launched, which will allow member states to share data easily with WHO. It is local data informs national data, and national data, as we share through the principles of solidarity and multilateralism, and respond to the international health regulations, we should be able to prevent an outbreak from becoming an epidemic and an epidemic from becoming a pandemic. We have learned several lessons, and data is central to that.
And the health challenges remain. I mean, we're not sure that was the last pandemic. In fact, there have been others before, so that very likely is not the last one. But one of the consequences was that national governments now were faced with an unprecedented health crisis. And Chris, I guess that capacity development in other countries then, at least in the near term, took a backseat to just crisis management at home, right?
Yeah, that's absolutely right. So this was a global pandemic. It affected everybody, and donor governments were no exception. So almost overnight, the UK, alongside many of its partners and other donors, went into crisis mode. So we diverted people and we diverted resources to trying to address the pandemic. And that will clearly have had an impact. And there will be relatively long-lasting effects of that. So it will take us a while to return to the norms that we established before the pandemic hit. I mean, just talking to some of the other points, I think the pandemic was a terrible thing, but this was quite a new thing. This was the first time in, I think, everybody's memory that we'd seen something on this scale. And it's natural that we didn't get everything right. I think the important thing is that this community and other communities learns lessons from that, to the early warning system point, to make sure we can see this coming again and prevent it from having the effects it did, not just on the global health of the people in the world, but also on the development impact that follows that.
But you never know where the next pandemic might come from. You don't know where it originates. And if you have we talked a lot about funding and the problem of funding statistics, especially in the global south. So that would exacerbate that problem because you cannot really monitor what's the danger. So it might come back to haunt us, right?
It could. But I think it's incumbent on us as the data experts to look for those signs. So one of the conversations that I've heard a lot over the course of the last 3 days has been, how do we get data from people like us who understand it into the hands of people that make decisions? And that's not about being in the detail of what the individual data elements show us. It's about abstracting that into the indicators, into the warning signs, into the patterns, into the success criteria that allow us to look for those things. So I think it's perfectly possible. We just need to take the initiative and build those bridges.
I want to stay with the capacity building just for a second, also because it was such a big theme during this conference. Samuel, now as a national statistical organization, what are the challenges you face?
So thank you, Arthur. I would also respond this in the context of the COVID, but I would want us to understand that before the pandemic, quite a number of things were happening, and in the case of Ghana, it was peculiar. One had to do with the entire data revolution that were going on globally and the big transition from traditional data sources to non-traditional data sources. And in the case of Ghana, we were in the middle of the census, so it was not just the pandemic, but we needed to figure out how we're going to deal with the pandemic in the phase of the transition to non-traditional data sources, and also to maintain momentum to ensure that the census is done. And thankfully, we are done with the data collection for the census.
So you had to do the basic work we talked about at the same time when you do the actual crisis work. Wow.
Yeah. I mean, let me come back to your question on capacity. And again, one of the sessions that we attended in this room was whether we are getting capacity development wrong. And I like the session that one of the panelists was blunt to say that, yes, we are getting it wrong. And the pandemic has really given us the opportunity to interrogate that from different perspectives. One perspective is how we responded to the pandemic in the sense that at that time, what was expected from national statistical organizations, were we supposed to wait for the policymakers to come to us and say that do A, B, C, D, or as a statistical organization, you take the initiative to do what we had to do. I mean, Ghana Statistical Service was not part of the initial team that was constituted to address the pandemic, but we thought that as a statistical office, it was our responsibility. So then we said, who has the capacity to develop a dashboard for people in Ghana to say that these are the hotspots? We didn't have the capacity in-house. We needed to look out for the capacity to get that done. Then it comes back to the overall question on capacity, which is being done in an ad hoc basis. For each basis, I say that we are getting it wrong. So one of the frontier recommendation is institutionalizing capacity building, and although national statistical offices are pretty skeptical in forecasting whether a pandemic would occur or not, if you look at other statistical agencies, they are drifting away from the core mandate of producing data and just developing tables for people to have a descriptive of it. But given the rich historical data that we have and the integrated and diverse data that we have, I don't think anything stops national statistical agencies in trying to predict the potential pandemic, or for that matter, epidemic that might occur at some point.
You mentioned the dashboard, which is interesting because these data-fueled maps have become some of the most important resources for both experts and the public in this pandemic. And the best example is probably Johns Hopkins University COVID-19 map, which is one of the most visited websites these days, I think. So, Clint, in a way, the coronavirus also proved the case for companies like yours.
Well, yeah, and we've been working quite extensively for a long time, along with our customers, with pretty broad user base across the world. The really interesting thing about what happened with COVID is, horrible as it was, the timing for the technical communities and the IT communities couldn't have been better. We couldn't have gone home and worked from home and worked virtually. We couldn't, like that Johns Hopkins dashboard, had it been 6 months earlier, would have been impossible to do. That first year in 2020, a total of 2 trillion hits, just to give you an idea of how massive that was. The other
Some of them were mine.
Yeah, I think all of us, had that same experience. But what happened is it was also a kind of a wake-up call for the geospatial community, and this kind of recognition that in this cloud computing world where all their data comes together, think about it, everything happens somewhere. So everything registers onto the surface of the planet, and that means data can be brought together in new ways, new insights, new understanding. One of the things that's happened for me is just recognizing there were 8,000 additional dashboards built worldwide in 2020 for COVID. So it wasn't just Johns Hopkins, who, by the way, the amazing thing about that information, do you know how long it took them to complete that first dashboard? It was overnight. It's an amazing story. There's a blog that Charles Brigham and I wrote that went on the World Data Forum website that has some links to some really interesting content that I think's worth looking at. And for me, that's one of the big breakthroughs that I've seen this week is, you know, all of the statistical and census agencies that are represented here. I think this conference represents kind of a milestone or at least a transformational time in the history of what's going on in your organizations, like how you guys build your data and deliver it. Nobody can find fault with your commitment and the good work that you do, but how do we bring our data together in these integrated kind of systems for the planet is really a really key thing for us all, I think.
Absolutely, that's probably the core question. What comes to the maps, though, we talked a lot about in the last few days about open access and how important it is to have transparency, and those kind of heat maps do that. But is there also a downside to it? I'm thinking that highly affected areas could be seen as no-go zones that are shunned and that might suffer for a longer time because they were marked as this red dot on a map, no?
Well, I think that's probably true, and I think we've all experienced it. I think many people would find fault with the black map and the red dots and the kind of doom and gloom of it. But it's pretty serious. It's interesting to look and see how other teams represented information in new ways. I think for all of us, it's kind of this iterative process. We're always learning and evolving as we go. I think, you know, if we approach it with the right values and the right commitments, and we do it as a community working together, I just think that's all we can do. You know, you can't do better than the best available you have, the best available information you have at any point in time. You have to be careful. We all have to recognize what the limitations are and to think about those. But, you know, I've just been so impressed with how people have responded to it more than the fear, I guess.
One other thing that was much discussed here was data stewardship, and of course everyone agrees that this is necessary, but there's few really large-scale, tangible initiatives. Switzerland has one currently building a kind of a search engine for metadata that George alluded to this morning. Also to ensure interoperability, which is really key, and maybe international organizations like WHO would be perfectly positioned to fill that stewardship role, also when it comes to accessibility and safety and trust, no?
Absolutely. I was looking at the title, The Road to Bern. And every road or every highway needs rules. And we did come from taking a road to Bern today. But I think if we really need to reach the 2030 target of SDGs, we really need a highway where we can all speed, but at the same time have governance as a foundation. So we have the rules of the game. We want to make data openly available, but at the same time have clear guidance that is easily applied so that we can also secure the privacy of the individual. And it is extremely important. Talking about geospatial, talking about boundaries, often we cross into political areas as well as security. And I think what we have proposed now at the last week's conclusion of the Global Health Data Governance Summit is to make sure that the data is effective, efficient, equitable, and equality of data. So I think there are nuances, but we are soon proposing some very simple guidance that can be operationalized so that we speak of governance not only as a conceptual, but also really in a practical way.
As a guidance, and that's certainly something that international organizations are looked to in that regard. But also what comes to actions, we have the state and the private actors. We've seen that in this crisis. that were able to join forces fairly quickly, not only in the data community, but just look at the vaccine development, for example. We've heard of such partnerships here as well, but Clint, how can they be maintained now in the, and to achieve the SDGs as well, and to really make permanent, if you will?
Yeah, so I think there's a place for public-private partnerships. And I think the key thing in all of those relationships is having clarity about who is responsible for what. And in the UK, I'll be honest, I think we have quite an uncomfortable relationship between government and the private sector. And I think neither party trusts each other very much. We all think we want something different. But I think with the right responsibilities in place, it's possible for those relationships to work. And one of the conversations I often have with my colleagues is we shouldn't try and do what we're not very good at. And equally, the private sector shouldn't try and do policy. That's the remit of government. And I think with those clear understandings in place, it's perfectly possible to have those relationships working. So I think we should be looking for all opportunities. We should be looking for all solutions to address these problems. It shouldn't just be an NGOs or a civil societies or a government problem. It's about the whole of society, whether it's the private, the public, or the non-government sector working together to address the problems.
And also, that from a donor perspective, but Samuel, I mean, in Ghana, do you have the impression that you can also shape the solutions that are really customized and that fit your local needs?
I mean, currently at Ghana Statistical Service, I would say we are at the frontiers of partnerships, because if you think about all the different stakeholders that we need to partner with to advance statistical production, we are there. We have a unique engagement with the private sector. That is what led us to put out the core detail records, which allowed us to use mobility to track the infection during the pandemic. And we have diverse engagement with diverse development partners. And that is why I put the initial submission in context that prior to the pandemic, we were going through a transition which enabled us to, for instance, have engagement with specific countries. So we have engagement with the Office of National Statistics, United Kingdom. We have engagement with Statistics Denmark on the front of administrative data, and quite a number of multilateral organizations. So quite a number of the non-traditional data sources that we've talked about here, we are practicing them right from the citizens-generated data, where we're looking at issues related to domestic violence and gender waste. We are using citizen science to capture this information. So there's huge potential in terms of partnering, doing collaborations to ensure that we really move the frontiers of data. But if you would want me to step back a little bit to the issue of stewardship, I think one of the things that, again, the road from Cape Town to Bern we talked about in Cape Town had to do with the legal framework within which we all work, which is the basis for the partnership to a very large extent. I think what we need to begin to think about is, given that a number of countries now have, let me say, good legal framework to work with, I think what this community needs to think about is the functionality of the legal framework and indices. And I think the issue of measurement have come up strongly in this conversation. How do we measure the functionality of this legal framework to ensure that the needed partners, the needed harmony that we need as a statistical community to advance data production and, for that matter, analytical work happens?
And not only for such an acute problem like a pandemic, but also, I mean, if you look at the SDGs, it's 17 problems, it's actually interlinked, and it's more problems than there are. But does that work for something as complex as the Sustainable Development Agenda?
It does, and again, it goes beyond the SDGs, and I'm looking forward to the countries that are supposed to do their censuses within the 2020 round, because that is really pivotal if you want to think about moving forward what we need to do with all the development agenda, including the SDGs. And clearly, the presentations that we've had in this 3-day period has to do with data integration. I mean, the SDGs cannot be achieved only from one data source. The strength of achieving the SDGs is really your ability to ensure that there's data interoperability, data integrated, and more importantly, not compromising the confidentiality and privacy that we talked about. But I think as a global community, we've not really thought through it very well in terms of the measurement and in terms of the procedures, and that is what we really need to work at moving forward.
I think that was well put, that data integration is one of the big themes, especially. I mean, I would like to get your point of view on that, because you've attended all the World Data Fora that we've seen in the last couple of years. So looking back to Cape Town and Dubai, what was different here in Bern, you think?
Well, it seems like the pandemic kind of transformed us. I mean, we were thinking hard about a lot of issues, but we didn't know what to do in Cape Town. We kind of knew what to do in Dubai. My sense is I was going to come to this meeting, and a lot of what I was going to talk about is what are we going to do to take action. But what I found when I got here, so first of all, you're the best, some of the best data collectors and producers in the world. The data you collect, you know how to do it. Your methodologies are really strong. A large part of that is how all that content becomes available to people. And what's interesting about the cloud revolution is coming here, you guys are ready to get going and are starting to implement. And I'll just comment that compared, at least from my perspective, to Cape Town and to Dubai, it's just a different game now. And I think we can do it. That's not to say there's not enormous problems and challenges, but kind of how information comes together, how sensitive information can be protected and accessed by people who have appropriate access to that information, and other people are locked out, all of those kinds of challenges. I think we've all at least experienced some of that by necessity in the last year and a half. And I think from that, and just that continuing passion and commitment that you have as a community to creating that data, I think a big thing going forward will be how do we transform data into information, and then how do we start to kind of broadcast or deliver information to people. That's also a really interesting aspect of geospatial. Many of you know about story maps and what those are, but that ability for users everywhere, including 6-year-old kids, to tell their own stories with information is all exciting to me.
Absolutely, and you said the game has changed, so if Bern proved to be a game changer, that of course would be great. So I want to get all of your perspectives on that core question. If we look, well, maybe not to 2030, but in the next 4 to 5 years, what remain the most important points to have a resilient and then an agile data ecosystem that is needed to achieve the SDGs, but also to respond to a crisis like a pandemic, or maybe the next crisis is something else. What do you think?
I often say 1 + 1 is equal to 2, but 1 + 1 could also be 11, and that is the power of partnership. And I think when we look back from Dubai to Cape Town, Cape Town to Dubai, Dubai to Bern, what we really need to institutionalize and leverage and unleash is the power of partnership in this room. And WHO is now ready to engage meaningfully with the national statistical organizations. We are, as health ministries or health institutions, are good in certain things and not good in, as you have already mentioned, the way the national statistics organizations operate is at the cutting edge, and I think now is the time to partner. Health affects all the 17 SDG goals, and data cuts across all the 17 goals. And we have pockets, when we look at least developed countries and small island developing states, that are often left behind with significant data gaps. So if we can use the power of partnerships to prioritize, do few things, do it well, do it fast. We don't need to wait for the next 10 years. We can fix the data and focus on saving lives and improving health and livelihoods.
So that's a stretched out hand from the WHO. You've heard it. Samuel, your most important points for the next 4 to 5 years?
Let me start with the part of honesty. And what I mean by that is, as a statistical community, we need to admit that the pandemic has made us prone to mistakes, in the sense that we have measured things in a way that possibly we didn't do them right. I mean, I hypothesize that we did get a number of things wrong, because we are yet to see how, for instance, telephone interviews vary from other modes of data collection, so that once we are making policy prescriptions, we keep in mind that the mode of data collection or some different sources of data really led to some mistakes that we did. And this gives us the chance to also think about what I think I saw during the pandemic, which goes beyond statistical illiteracy, and I emphasize on what I call statistical mischief. And we really saw on the global level how people were using numbers in the wrong way around the pandemic. And this did not happen only at the global level, it did happen at the national level and even at the subnational level. So what I mean by honesty is stepping back, looking at the pandemic, looking at the transition, and be modest and say that, did we really make some mistakes? And from my point of view, with an academic hat, I think, yes, we did make some mistakes.
Well, which was also unavoidable, but I mean, the next chance is always a chance to do it better. Chris, what are your main points for resilience and agility in the next 4 to 5 years?
Well, I'm quite pleased you didn't ask me the question about how this compares to Dubai and Cape Town, because this is my first World Data Forum, so I was at risk of causing a diplomatic incident.
Of course I knew that.
Saying it's the best. It's the best, and the Swiss have done an amazing job, so thank you. So I think the interesting thing for me is that, there's clearly a huge amount of expertise and enthusiasm in this room and sort of around the world virtually. But my sense is, as with all of these events, when we go back to our offices and our homes, we get stuck in our day jobs. And all of the great things that we've spoken about in the room, we don't have time for. So I think just in looking at the road from Bern, it's how do we agree what those tangible, concrete things that we're going to do together are. So locally, I think everybody is doing great work, but there are so many lessons that we can extract from that, and that's the value of this community, is how do we share those, how do we accelerate capability in countries based on what others have had to go through before. I think there are probably two things that I'd suggest we focus on, and the first is that point that I've made earlier, is about building that bridge from statistics and data teams to decision makers. Because collecting data is great, and if we can understand it and we can get value from it, that's a fantastic achievement. But the real benefit comes from when you get it into the hands of decision makers. And I think the pandemic has changed the relationship between the data community and politicians or decision makers. So in the UK during the pandemic, we had our chief statistician, or a national statistician on television. He was recognised in the street. That's crazy, but it happened. And people understood that you needed the data to make the right decisions. And as Samuel says, mistakes happen, but starting to surface that conversation and to understand that the statistics, as much as we want them to be perfect, are not perfect. There are uncertainties associated with them. That's a really healthy debate to have, and it means people can start to make decisions without expecting everything to be perfect or certain. And I think the second thing I just suggest we focus on is looking at getting the basics right. So I think in the room there are various different levels of capability, and there are lots of really exciting conversations about machine learning and data science and using AI techniques. I think focusing on the basics first and getting those in place is the best way to get the value from those particular techniques.
All right, but new technologies are always a part of what you talked about. I take it in your points, this is probably it's high on the list when it comes to the things to be done in the next 4 to 5 years.
Well, I think certainly, what's really interesting is that conversation about information quality is really important. What we often do, and it's a little bit reality and sometimes by convenience, is in our community the idea of using the best available data that you have and doing the best you can at making decisions is really important. That doesn't mean you don't think critically about the limitations of that information or what you learn, you know, like experience is always that amazing teacher. I really appreciate what you're saying about all of us going back and looking at the information, doing kind of a post-mortem. There's so much we can learn from those events. I mean, being thrown into these things, nobody would wish this on themselves, but we have this opportunity, I think, to rise up out of that and to be much more intelligent and much more experienced in what we can do. And there's a certain wisdom that comes with that. What I see in the group, that's the other thing that's been really interesting this week, is just to kind of, there's a certain level of humility that many people demonstrated from the stage when they were talking about their own struggles through this. I think we all understand we're human, and we're going to make mistakes, but we're not going to make them on purpose in this community. Not like some groups. I don't want to talk anymore. Shut up.
That's all right. No, anyway, I wanted to go to questions anyway. Well, it's not because of that. No, but it is part. If you want to look back and take a hard look at your own work, it's always good to ask other people what they think. And we're going to now open up for questions. And I'm sure you've noticed that I have 4 billion people up here on stage, so you will have a lot. But I will give the first question to our online community this time, because we have a question from Switzerland. And I think it's quite an interesting one. As we strive to be more data-driven, is there a risk that we drive ourselves by the data that is most easily collected? If so, how do we counteract that? So that we're just going for the low-hanging fruits. Is there a danger?
Every country should have timely, reliable, disaggregated, actionable, and accessible data. There are no shortcuts to it, and we can do it. So we must get going with it. There are only 194 member states, not many.
But as I understood the question is that are we collecting the data that it's most easily attained, or are we really doing the hard work to get to the important information?
I think we are doing both. We are doing what we can that is easily collectible, but we are not addressing areas of inequalities, for example, hard to reach populations. We don't have good information on out-of-pocket expense for essential services. We are unable to use the data at the subnational or district level that could help really improve the performance of care at the primary care level. We are not adequately using the maps and geospatial information to locate where the health facilities are in relation to the population density. So there are areas that we can certainly improve, but there are various countries and various communities and institutions that are doing bits and pieces. But when we bring that whole through the power of partnership, I think we can address both.
Walk and chew gum at the same time, as they say.
Exactly.
All right, I see there's a question in the room here. We go to the lady right there, and please state your name, organization, and who the question is for.
Thank you. My name is Nenna. I come from the internet. You know my agenda is connectivity, gender, and communication.
Yes.
I left New York on February 28, 2020. I was there for the international conference, Counted and Visible, for those of you who remember. And that was the last trip I had till today, till Bern. It's been over 18 months. I have 2 points to make. WHO has done a great job, because were it not for the data that was mounted every day and updated, the media would have told a different story about deaths in Africa. I came here to say that, because I live in Africa. We would have had a different story. For those 18 months, I've had at least 4 dashboards on my laptop every day monitoring the data. However, my point in getting up now is on counted, visible, and something missing in between. Counted, connected, and visible. As at this morning, we've had over 6 billion doses of vaccine administered across the world. The data is open, anyone can access it. And when COVID broke, we said, get online, go to school online, work from your home, get connected. My agenda now is that of connectivity. And Asma talked about those who are not visible. I believe that counted and visible can only happen when we get connected. So here's my question. If we can give 6 billion doses of vaccine in less than 1 year, can we please, dear speakers, deploy the same urgency, deploy the same collaboration, deploy the same cooperation, deploy the same means and intermediaries and partners to connect the unconnected? Counted, connected, visible. That's the title of my intervention. Thank you.
Very well put. I do not think that connectivity is exactly the up to the WHO, but probably, I mean, if you want to talk to that?
I'll try. So I think what is very clear with this pandemic is the impacts have been felt unevenly. And those who are most disadvantaged have felt the biggest impacts. Part of it has been that those who could cope with the effects of a pandemic have, and all the advice I think that most countries have given out have been based around that. I have a personal view on whether I think that was right. It's probably best for me not to share that in an open forum. But I think the impact of that pandemic has now shown that we need to put our priorities in different places. So before that, connectivity was important, but was it critical? Probably not. Now what we're finding is absolutely critical. People need connectivity to be able to exist, so whether it's to go to school, whether it's to be able to work safely, or whether it's just to follow the guidance and the rules that your government is telling you to do, because the healthcare situation is really difficult. So I think the donor community will look really hard over the next period about how and where we prioritise the funding. I think that's absolutely the right thing to do. And connectivity, I'm sure, will be one of those areas which is looked at really, really hard.
We have another question from our online community, this one coming from the US. And it's a very international one. With some of the global versus country-confined challenges facing us, i.e. pandemic, global warming, other crises, are we moving to global platforms? An integrated global platform that tracks and measures SDG inequalities and gaps and helps to mobilize resources to address them. A global platform. Is that stuff of dreams?
Well, yes, and I think it's almost a setup kind of question. Our president, Jack Dangerman, I think most of you know who he is, talks about GIS as a digital nervous system for the planet. Perhaps you've heard that before. There are 350,000 organizations worldwide. So far, they've placed 46 million items into an information catalog for the world. Over half of that information is shared. About 20% of that information is shared without any restrictions. Another 35% are shared by collaborating organizations and individuals. For example, wildlife biologists and conservationists will share data about species at risk with each other, but not publicly. The way that happens in these cloud systems, you guys all know what you do. You log in, you have identity in the system. Your identity is how that access is granted or restricted for people. But what's happening, and the great promise I think that's going on with geospatial is this cloud global platform is starting to be implemented for specific communities. Imagine one built around not just the SDGs, but real specific set of related SDGs. And that community has members from all over. and there's other communities, but every big problem, global warming, racial and social equity, the next pandemic, education, whatever these things are, we need these kinds of systems where we can come together as communities. And I think that's one of the things that is really driving our work, is to try to work with our customers to try to implement those things, and also to try to kind of capture the best practices. How do you really go about implementing those things?
I would like to get Samuel's take on that, because, I mean, isn't there a risk also, there's such a lot of metrics, and somebody has to decide which metrics to follow, and is there a risk that it could be just the rich world telling, okay, this is important, and others just sort of are not to be seen?
I wouldn't agree that there is that risk. I think increasingly national statistical offices are becoming aware of what they need, and they are increasingly contextualizing what they need. So yes, we need all the matrices around, but I think the capacity to choose to say that this is what is going to be helpful for us, and this is an international way to go. And a typical example are all the indicators that we look at. You take the unemployment, they say that use ILO, but a number of NSOs in the South are beginning to look at unemployment in their context of the informal sector and that. So I wouldn't push that argument on the risk of getting people to be bogged down with what is happening at the international level.
Okay, let's see. Another question from the room. We have a lady right here in the front. Urs will be right there. Oh, yeah, he's running, yeah.
Thank you, panelists. My name's Claudia, I'm from Development Initiatives. Firstly, thank you for recognizing the absolutely vital role that civil registration plays. It's the absolute backbone of a robust statistical system. Now, Chris, you've said that we need to get the basics right. And Samira, you said that actually we don't have good enough death registration information to really know the true toll of this pandemic. And Samuel, you said we've got to admit when we get things wrong. So, Chris, we've been monitoring deaths and cause of death since the 1870s in the UK. We stand here in Bern 150 years later. My question to you panelists is, one, what are we doing wrong? Because we've got to change. If we keep trying to fix this in the same way and expect a different result, I think we're in some kind of collective madness. So what do we need to do differently? Thank you.
Be my guest. Who wants to start?
Thanks, Claudia. I think you have really placed the finger on the nerve. We must prioritize, we must invest. There are already very good practices where countries have good birth and death and causes of death. It's only scaling those at speed. Governments and international, multilateral, public-private partnerships all can coalesce together. Let us just prioritize before we go to wherever this conference takes us. We should be proudly able to report that we are not standing behind the 1 billion invisible people. They are 1 billion invisible because they don't have birth certification nor death registrations and the implications of those. We have to fix it. There is no other way to say that we are missing the opportunity to fix it.
There's some really interesting examples with the World Health Organization, both Ebola and polio vaccination, where, you know, sometimes we do need a swift kick in the pants to get us going. And Ebola is really fascinating. The fall when Ebola was breaking out, the curve, the kind of forecast for deaths was this kind of accelerating arc. And I know most of you will recall this if you're old enough. Anyway, but what happened is the World Health Organization didn't have enough information. And the community, the geospatial community, mobilized and started collecting the data about they really needed to get a handle on where people lived, where the populations were in these rural areas. And the data was there to do it. There was just never the incentive or the motivation to build it. But these teams did it, and it took a month, maybe a couple months, for them to collect this data, and immediately the World Health Organization started to apply these protocols, these kind of public health protocols to isolate patients and to remove the dead and so on. And they turned that curve. They turned it. I mean, they saved millions of lives. Sorry.
No, that's okay. Please. And that's what the right data in the right hands at the right point in time can actually do.
Right.
We have a question from our online participants, and it is from Ghana, so probably, Samuel, I will assume it is for you, because let me read it to you. With the increasing actors in the changing data landscape, where should resources focus? More collections, more analytical products, better communication, better IT infrastructure? Those are all the themes we heard in Bern as well. Where should governments prioritize where should development cooperation providers focus, especially in the global south?
And thank you, Atta. Permit me to just step back to Claudia's question. And
Please.
When she asked the question, I also reflected on when in Ghana we established our births and deaths registry. And I'm not too sure about when it was established, but I get a feeling that it's equally about 100 years ago. So my recommendation on that front is learning best practices. I mean, the statistics that you put out there is really staggering. If you think about Ghana, where about just 60% of births are registered, and you have birth and death registry set up over 100 years ago or so, then it raises concern. And that relates to the first point that I made. We set up these systems, we get these laws made, and I think where the development community or communities such as this should continue to pursue the agenda is what are the functionalities of these organizations? Because it's one thing setting them up, and it's another thing following through to ensure that they work. I mean, until recently, Ghana, we've realized that if we don't fix our birth and death registry, we're gone. So now it's gotten to the vice president level, where we have a multi-sectoral committee responsible to ensure that all the different sources of data that we require to ensure that we improve our birth and death registry happens, it does. Because the registry alone would not be in a position to ensure that we have increased uptake. And the reasons are pretty obvious to all of us. Now, coming to the question, my response will be biased, really, in the sense that I keep on hammering the point that statistical agencies should move away from data collection. And unfortunately, we don't think about the entire value chain. I'm happy one of the sessions in this 3-day forum talked about the entire data value chain. And I start from the perspective of statistical agencies looking at the development frameworks that they have, the global one, the regional one, the national one, and begin to think about the data that the country needs, and begin to push policymakers to say that, yes, we are doing the traditional ones, inflation, GDP, PPI, because it's international recommendation, but what dimensions of this data are we producing to ensure that it responds? So the whole idea of conceptualizing is what I start with. Then we push away data production. It's just going out there to collect the data. Unfortunately, now we have overload of information from different sources. And where national statistical offices should put emphasis on is the analytical part. And that is where a lot of traction got to Ghana Statistical Service at the pandemic, when we rolled out different trackers to say that this is what is happening to businesses, this is what is happening to local economies, and this is what is happening to households. So resources, from my point of view, as I said earlier on, should be focused on, one, telling the country what they need, conceptualizing the issues, and doing more of the analytical work. Thank you.
And have a sovereignty when it comes to the metrics, depending on which country it is. Please.
So I couldn't agree more. And I think I've said this in a few sessions. I think rising up that data value chain and doing more in the space where you're delivering intelligence to decision makers is how you get the buy-in, it's how you get the funding, it's how you make a difference. And I think we had a question earlier about basically, are we collecting the easiest data? And I was thinking of the fact that humans are inherently lazy things, so we will try and put the least amount of effort into anything. It's kind of how evolution has created us. So it's incumbent on us to make sure we don't do that we really challenge ourselves, and when we have a problem to fix, we step back and think, well, what are we trying to do here? What data do we need? And do we have it? And if we don't, how do we get it? And if we can't get it, what assumptions do we have to make? How do we model things? How do we work that through? And just to Claudia's point, I mean, I won't pretend to know the answer to that question. I think that would be a little bit silly. But I think it's about looking at what has worked and how do we take those lessons and bring them into the countries where we need to do more work. Perhaps there's a maturity model that says if you are starting from here, you need to do these things first, and this is how you do it. This is the blueprint that's worked. That feels like a place to go. But then back to the question of where do you invest? So there's limited funding, and of course we want to invest in every part of this data value chain. That's where we need to go. But I think I really would encourage us towards the higher end of that, because that's where we really start to embed the value and we start to take the opportunity to do more of what we want to see.
Thank you. I think that will have to be it, because there's only 1 minute left. But of course, make sure that you continue the conversation on Twitter as well, using the hashtag #UNDataForum, or direct your questions and comments to the handle @UNDataForum. We'll have to conclude here. I thank my participants for their insights and their answers in the Q&A. Samira Asma, Samuel Kabine Anim, Clint Brown, and Clint Jones. Everyone.
Thank you very much.
Thank you. Now, having assessed the progress of the last couple of years, as well as the challenges that remain, as we just did, we now turn to a more future-oriented perspective. What is the road from Bern going to look like, and how is the global action plan being updated? Here to guide you through this is the co-chair of the High-Level Group for Partnership Coordination and Capacity Building, Ola Awad. Ola, please.
Hello, everyone. Well, we're coming to the end, and we're coming to the very exciting part. So you can have a seat here.
Yep. Thank you.
Yeah, that's
okay?
fine. That's fine. So my name is Ola Awad. I'm the Chief Statistician of Palestine, and I'm the co-chair of the High-Level Group on Partnership, Coordination, and Capacity Building for Statistics for the 2030 Agenda for Sustainable Development. I would like to welcome you all joining us physically here in Bern and virtually to the second part of this high-level plenary session on the thematic Area 6. In this second part of the session, we'll provide an interactive discussion to receive participant feedback and generate recommendations for the way forward for this agenda, with a view to paving the road for deliberations and outcomes of the UN World Data. This part of the session will seek to present an overview of the new challenges and increased needs for financial and technical support, especially in the times of the pandemic. The discussion will aim to better understand the state of play for financing data and statistics and the implementation of the Cape Town Global Action Plan and Dubai Declaration, drawing on the latest activities of the High-Level Group on Partnership, Coordination, and Capacity Building for Statistics for the 2030 Agenda for Sustainable Development, and the rest of the data ecosystem. Allow me to start by stating that the Clearinghouse for Financing Development Data, which was launched during this forum by Paris 21 and the Bern Network, is a great achievement. And it's great to have such a platform with information on funding flows to data and statistics, both from development partners and domestic resources. It will be a powerful tool for planning and to realize smarter data financing for the countries that need it most. As co-chair of the high-level group, I'm very pleased to see such collective momentum that has emerged for financing development data, which is a fixed item on the high-level group agenda. Allow me first to welcome Ms. Maria Francesca Spatolizano, the Assistant Secretary General for Policy, Coordination, and Interagency Affairs in the United Nations, to hear about UN's commitment to the implementation of the Cape Town Global Action Plan and how the UN can facilitate collaboration and ensure coherence across key initiatives for more and smarter financing. So the floor is yours, Francesca.
Thank you very much, Ola, and hello, everybody. It's a great pleasure to be here with you. Let me start by saying that data are no longer an expert concern for technology or statistician teams alone. They are, in fact, something which permeates everybody's life and work nowadays. And I would say more than ever, this year's forum reflects this reality, and I'm very pleased with what I heard and what you're doing. And I have 3 small points to make and maybe one final remark. That is, first of all, governments have responsibilities. And they did not shy from these responsibilities when they adopted in 2015 the 2030 Agenda and the Sustainable Development Goals, because in that context they assumed the responsibility and committed to improve to address the data gaps, to strengthen data and statistical capacities, to scaling up the work you do, the cooperation with public and private entities, and use all sorts of available data sources. And then this big program, of course, was there starting, and then the pandemic hit, and what we can draw as a lesson, I think we all learned how important, in fact, it is to have the right data, as the panel before us was saying. And these data have to be timely, accurate, reliable, and they have to be disaggregated. In other words, if we want to act, we need to know where our people are, what they need, and what we can do, how we can do, etc. So progress is uneven, of course. The situation on the ground is different, and even though these are the data and the statistics which support them strategic assets, they are often lacking, and not everybody has all they need, it's clear. So first thing, we need more new investment. We need to be ahead of the curve. We have to anticipate the future needs. That's sure that there will be more pandemics, but also more events. We need to have some foresight. And of course, we still need to implement the SDGs and the Agenda 2030. So more investment is necessary. Secondly, the United Nations, of course, have a role, and I come to your question, because the Cape Town Global Action Plan is there. It was adopted in 2017, and it's, you know it better than I do, of course, is a roadmap for the evolution of the statistical and data systems to strengthen the capacities. And the global community, you all, have indeed worked to introduce innovation, to work together, multiple initiatives. I will quote here the Data for Now by the UN, the Global Partnership for Sustainable Development Data, the Sustainable Development Solution Networks, and all these focus on national and local needs and priorities. Third point, I go very quickly because I know we don't have a lot of time, is that, of course, we now have this unique opportunity to implement this Cape Town Action Plan and drive forward with the Agenda 2030 and launch new key solutions, mobilizing smarter finance, as you mentioned, indeed, the World Bank Global Data Facility and the Bern Networks Clearinghouse for financing development data. And we do this together, of course, with the World Bank, the Paris 21, and guided by the high-level group for partnership coordination capacity building. So we need this facility to scale up the support for your national systems and the clearinghouse to complement it and become the hub, the community hub for all this. So the role of the UN is in all this to facilitate the synergies and the working together and the complementarity of these two instruments. And I commend all the effort you are doing already in this direction to bring coherence at the international level. So in conclusion, very, very quickly, let me say a word about a broader data ecosystem. On the road to Bern, we need to put from Bern, sorry, we need to put the real world challenges at the center, people at the center. As it was also said in the previous panel, of course, we want to deliver solutions. Data have to help to do that. And has to, as you probably know, this is also the idea at the heart of the Secretary General data strategy. It's never about technology for its own sake. It's to find solution, to lowering barriers to data access, to strengthening the standards for the use so that these data are meaningful, are reliable, and to enabling more people to participate in the generation, in the insight, and have a certain impact. So it's ultimately about empowering citizens to leverage the data and to be for accountability. And I'm convinced that this global community can raise to that challenge, and I commend you for that, and I thank you.
Thank you so much. That was really very helpful. And since the first World Data Forum, which was in Cape Town, and we're coming for today in the third UN World Data Forum, we were talking about the Cape Town Global Action Plan, and so many developments have been taken on the ground. And I mean, in the high-level group, we decided, our Cape Town Global Action Plan will be updated based on the developments that we have. So thank you so much. And I now give the floor to Ms. Haishan Fu, Director of World Bank Development Data Group, joining us virtually to share exciting work that has come to fruition after working extensively over the past few years. Haishan Fu, the floor is yours.
Thank you very much, Ola. And thank you all for yet another successful World Data Forum. It's really heartening to see how much we have already accomplished together on the road to Bern. And I couldn't be more excited for all the opportunities that lie ahead of us to ensure data is harnessed to improve lives and transform economies. That's why it's given me such immense pleasure to formally launch the Global Data Facility today. The Global Data Facility is the new fund hosted by the World Bank, designed to mobilize and coordinate donor support for data and statistics priorities at the global, regional, and local levels. The story of the Global Data Facility is the story of a promise made and a promise kept. It was in 2018 and the second UN World Data Forum in Dubai that the UN Statistical Commission's high-level group asked the World Bank to establish an innovative global financing mechanism, a mechanism that will strengthen the capacity of national data systems and help overcome data deprivation so we can better implement the global the Cape Town Global Action Plan to support data for the SDGs. In Dubai, we made a commitment to that concept, and today, I'm proud to say we honored our commitment and are delivering on our promise. The Global Data Facility is really the result of a collaboration with the high-level group, country partners, the UN, SD, the Bern Network, and its members, including TA6.01 and the GPSDD. Their support and partnership have been absolutely invaluable. So was the advice from colleagues in countries across the region representing government agencies, as well as civil society partners and think tanks. Through extensive consultations, they have helped shape the priorities for support by the Global Data Facility and to ensure that it will deliver on countries' data and statistic needs and demand. Indeed, the Global Data Facility is designed to ensure that demand drives investment and to scale up and improve coordination across development partners, practitioners, and country clients. It will leverage larger financing, including through World Bank's IDA and IBRD loans and grants. It will also help ensure long-term support for data and statistics priorities by better catalyzing domestic investment. Operating in tandem with other initiatives, such as the Bern Network's Clearinghouse, the Global Data Facility will aim to optimize coordination and alignment of support and priorities around the world, especially fragile countries that are facing tremendous challenges. I'm extremely grateful for the high-level group's enthusiastic endorsement and support for the Global Data Facility. I'm thrilled that the World Bank and the UN will jointly convene a Development Partners Forum soon to step up investment support and coordination for the data agenda, including channeling resources through the Global Data Facility. And I'm confident that the Global Data Facility will bring us much closer to realizing the new social contract for data based on value, trust, and equity as put forward by the World Development Report 2021, Data for Better Lives. But let me be clear, the hard work only begins now. The Global Data Facility is fully set up to undertake its important mission, and thanks to development partners, including the European Union and IMF, we're off to a strong start in mobilizing funds. But there's much more to do and long way to go. And as we move further into the decade of action, and as countries work towards recovery in the aftermath of COVID-19, it is essential that every partner and every member of the international community step up its support for data and statistics. According to the result of the high-frequency global survey UN and the World Bank conducted last year, we know that national statistical offices in low and lower middle-income countries were the hardest hit by the pandemic. 9 out of 10 had difficulties in meeting their international reporting requirement, as opposed to 5 out of 10 in higher-income countries. The pandemic is clearly enlarging the global data inequality. So if ever there was a time for the Global Data Facility to assume its urgent mandate, it is now. But it cannot do so without your vital support. So let's seize this unique opportunity and come together to get the Global Data Facility off the ground. That is what brings us all here today, and I'm grateful to our hosts for the opportunity to voice this call to action. And we love to work with all of you to make sure that we can successfully implement the Cape Town Global Action Plan through the Global Data Facility. Thank you very much.
Thank you so much, Hai Shan-Fu. And I mean, the Global Data Facility was such a great achievement, and as you just mentioned, we have a long way to go still. I now welcome Mr. Paul Schreier, the Chief Statistician and Director of the Statistics and Data Directorate in the OECD, to share the work on mobilizing smarter finance for development data. The floor is yours, Paul.
Thank you, Ola, and hello to Bern. I'm sorry I can't be with you face to face. There's a ministerial meeting ongoing at the OECD, so I had to stay in Paris. But even from a distance, I could see that there's a lot of energy, interest, and enthusiasm that has been mobilized during these past several days. And of course, I'm really excited to see the clearinghouse for financing development going ahead. And of course, Paris 21, hosted by the OECD, is directly involved in this. And I was equally excited to hear from Haishan about the World Bank's Global Data Facility, another practical and important initiative going forward. There's not much time, but I would like to make two things. One, a short announcement, and one leave a message, and both are about sharing and cooperation. My announcement has to do with the ongoing ministerial meeting that I was just mentioning at the OECD. There is a OECD Council recommendation on enhancing access to and sharing of data that is being put forward to ministers basically as we speak. Now, when the OECD puts forward these recommendations, these are soft law, but they tend to be important when they get the political weight that ministers bring to this meeting. And in this case, it is broadly about findability, accessibility, and reliability of data across organizations, public and private, in countries. And I really trust that the recommendation will make its way into the policy areas in OECD countries and beyond. And my second point is really a message going forward. And I've said that in different contexts, but I think it's worth reiterating that cooperation and co-investment at the international level is absolutely vital going forward. We are all trying to create what could be called a public digital good that has different facets. It can be a public good about knowledge, and this is where things like the clearinghouse comes in. It can be a public good in terms of the tools, and here we have things like the Statistical Information System Cooperation Community. It can be a public good in terms of accessing data from private sources, and there is, for example, a development data partnership that a number of international organizations have undertaken to have a coordinated conversation with private data providers for research and data development. There's the SDMX project. There's the high-level group on modernization of statistics. There's a lot going on, and it's all built on the premise that we are building public goods. Public goods have high fixed costs. We face the same issues. So the most efficient way, also in an environment where resources are scarce, is to invest jointly, to go forward jointly. And this is really the message that I would like to leave here. And I think it's quite consistent with many of the things that we've heard in the past couple of days. Thank you.
Thank you so much, Paul. And as we are running actually out of time, I just will give the floor to my co-chair partner, Ms. Elsa, that she can give us some closing remarks in a few minutes.
Thank you, Ola. As the time is running, I want to congratulate our partners on this announcement, which represent a great step forward towards achieving our objectives set up in Cape Town Global Action Plan. As a co-chair of the high-level group for partnership, coordination, and capacity building, I would like to express our commitment and support of the whole group for the two initiatives guided by the UN Statistical Commission. We want to be sure that our role as a group is to communicate the needs and priorities of the country's statistical and data systems, provided through the inputs of the member of this group represented by the chief statistician, to inform and to support the implementation of the objectives of the Cape Town Global Action Plan within this framework. And finally, I want to encourage the global data and statistics community to support the message and to amplify that we should realize the Global Action Plan precise in Cape Town. Thank you.
Thank you, Elsa, and thank you for your patience. And we come up to the end of this session. Thank you, everyone.
Thank you.
Thank you so much.
Thank you.
If you're still in the room, just a quick reminder that we're actually already going to be going on in 5 minutes, because it lasted a little longer than we wanted, but we have a very special guest in the next session. So if you want to grab a coffee or visit the restroom, no problem, but make sure it doesn't take up too much time. See you soon, 5 minutes.